Hello and welcome to Docplexus News. Doctors at Rashid Hospital, Dubai have successfully removed a large abdominal tumor measuring 33 centimeters in length and 25 centimeters in width. The patient was suffering from a rare intra-abdominal tumor known as a mesenteric cyst of cavernous type. This tumor was attached to the colon, small bowel, main arteries and veins, making the extraction all the more difficult. Nonetheless, the surgery was successful and the patient was discharged in good health after 2 weeks of treatment. Doctors in Ras Al Khaimah performed a complicated surgery on a 26-year-old man who suffered a right hip fracture dislocation in a car accident back in 2008. Since then, he had undergone multiple surgeries to repair the fracture, which resulted in a shorter right limb. Following a special hip replacement surgery to correct the severely arthritic hip, the normal length of the right limb was restored. The patient regained complete mobility and was able to resume his normal lifestyle. The US FDA has recently approved a new bioelectronic device that will help the users get relief from sinus pain occurring due to allergic rhinitis. This handheld advanced neuromodulation device measures the user's skin properties and applies gentle microcurrent to stimulate the underlying nerves, thereby alleviating the sinus pain. The US FDA has recently given the safety approval to an ongoing year-long stem cell treatment project for rotator cuff injuries led by researchers from North and South Dakota, USA. Rotator cuff tear injury is the most common cause of orthopedic impairments in the US. Therefore, FDA's safety approval of stem cell treatment will help to change the lives of millions of people suffering from it. The US FDA has given clearance to a new medical device invented by a Twin Cities neurosurgeon to detect signs of concussion by tracking a patient's eye movements. The device, called the eye box, was invented by Minnesota neurosurgeon Dr. Uzma Samadani. This device has been cleared as a quick, non-invasive test to detect concussions by having the patient watch a screen and track the eye movements. The Tumor Hospital in Fujairah has adopted a unique technique of using Cuddly Octopus to improve the health of babies born prematurely. Physicians believe that placing a cuddly crochet octopus close to the premature babies in their incubators helps to improve their heartbeat, breathing, and increase blood oxygen levels. The technique has helped doctors in early weaning off of babies from intensive care with better and faster growth. The UAE Ministry of Health and Prevention has issued a warning against the use of injectable Fluoroquinolones. The drug causes rare but serious infections, including rupture of the main artery or aorta, and may lead to serious bleeding or death. The ministry has recommended the physicians to avoid prescribing it to elderly patients and patients with vascular diseases and certain genetic conditions such as Marfan syndrome and Ehlers-Danlos syndrome. A team of pediatric surgeons in Montreal, Canada have successfully performed a unique surgery to reduce the skull size of a 2-year-old girl with hydrocephalus. The baby was born with a dangerously large head measuring 76 centimeters in circumference due to accumulation of more than 3 liters of fluid in her brain. The baby's skull bone was splitting apart along with atrophy of her brain tissues. In a 12-hour surgery, the surgeons lacerated the scalp from ear to ear and removed the skull in pieces. Nearly 2 liters of fluid was drained from the brain. With the aid of 3D printed models, the girl's skull was reconstructed. Following surgery, the head of the baby was substantially reduced and there was a marked improvement in her daily activities. Docplexus congratulates the medical team for this successful surgery and wishes well-being of the baby. These were the latest happenings in the medical field, brought to you by Docplexus, one of the largest online communities of doctors. Stay tuned for more. Happy Docplexing!